Good evening. This is a study to Introduction of Human Development. And in this unit, we will briefly talk about the various theories of development and the child development theories for these developments and how an individual grows throughout the lifespan. So our learning goals and objectives for this presentation, we're going to describe the physical changes that occur during prenatal development, define and discuss development from infancy throughout childhood through adulthood, mainly Piaget and Erikson. We're going to discuss Vygotsky and his zone of proximal development. We're going to discuss Kohlberg's theory of moral development. We're going to discuss characteristics of early attachment, gender role development, the effects of long-term daycare. We're going to discuss Dr. Kubler-Ross stage of theory of death and dying. So what is development and how do we define it? Well, it's defined by different theorists in different ways, but basically mean the same thing. And most define it as a series of age-related changes that happen over the course of a lifespan. And of course, there are several famous psychologists that we study, including Sigmund Freud, Erik Erikson, Jean Piaget, and Lawrence Kohlberg, who describe development as a series of stages, and each of these theories believe that individuals develop in different ways. A stage is a period of development in which people exhibit typical behavior patterns and establish particular capacities. Various stage theories share three assumptions: that people pass through stages in a specific order, stages are related to age, and development is discontinuous with qualitatively different capacities emerging in each stage. Development is continuous. Now, just a brief overview of prenatal development and how we develop before birth. There are various stages of prenatal development, and stage 1 is a germinal stage, which is a 2-week period after conception. And then conception is when the sperm and the sperm cell combines with an egg cell, forms, and it becomes now a zygote. Implantation, 7 days after conception, cells divide and embeds in the uterus. Okay. Then formation of the placenta takes place and serves two functions. It's placenta. It passes oxygen nutrients from mother's blood into the embryo or fetus, and it removes waste materials from the embryo or the fetus, and the umbilical cord forms and is a very important aspect during prenatal development. Now, in stage 2 is the embryonic stage, which lasts from the end of the germinal stage to 2 months after conception, and it is now called an embryo at this stage. This is where major organs form and the embryo becomes fragile. And the end of the embryonic period, now the embryo is about 1 inch long. Then the next stage is the fetal stage, which is actually the last stage until birth. It lasts from 2 months after conception until birth. So it's very important at this time that the mother takes very good care of herself. This is where all the sex organs form, the fetus starting to grow and develop quickly, your bones and muscles form, and the baby begins to move inside the mother. Organs continue to develop and start functioning. And then the last 3 months is when the brain really starts to grow rapidly in size. They start developing fat. And then this is where the respiratory and the digestive systems become independent. Now, there are very, very important factors that can lead to problems before the baby is born if the mother subjects herself to these. Any of these, such as viruses, certain drugs, or radiation, that can cause deformities in the embryo or the fetus before they're born. Some really adverse factors that mothers need to be aware of: poor nutrition. If she drinks, smokes, uses certain over-the-counter drugs, recreational drugs such as cocaine, marijuana, heroines, and if she exposed to x-rays and any other kind of radiation, if she developed AIDS, German measles, any of the STDs such as syphilis, and if she develops cholera, smallpox, mumps, or severe flu. And moms need to really take care of herself during this stage while the baby is developing. Now, who determines the sex of the child? Well, the sex of the child is determined by the father. The father contributes an X chromosome, the child will be a girl. And if the father contributes a Y chromosome, the child will be a boy. There are 46 chromosomes totally, 23 pairs, and the child is given one chromosome from each of its parents. Now, one of the effects of drinking during pregnancy, because alcohol crosses the placental barrier as other drugs, is fetal alcohol syndrome, which is so common that we see. There are different facial features that develop: small birth weight, small head circumference, as you can see in these diagrams, small widely spaced eyes, flat mid base, the nose, short upturned nose, smooth wide filled tongue, and a thin upper lip. And there are some intellectual problems that occur in infants who are diagnosed as fetal alcohol syndrome babies. Their IQ ranges are very low to above average. They have difficulty storing and retrieving information. They struggle with abstract concepts. They have trouble staying at task, difficulty generalizing knowledge and experiences. And these children sometimes develop other cognitive difficulties as they grow and develop. You know that babies have various temperaments when they're born. And Thomas Chess in 1977 identified that babies have one of three basic personalities. They either are easy babies, they're difficult babies, or they're slow to warm up babies. And as you can see here, easy temperament babies, they tend to be happier, they adapt easily to change, they have regular sleeping and eating patterns, they don't get upset easily, they're usually just happy. Children tend to be less cheerful and less adaptable than easy children if they are slow to warm up babies. They're cautious about new experiences, they don't really like to go to strangers. Their sleeping and eating patterns are less regular than those of easy children. Now, difficult babies, these children tend to be real very irritable, easily to upset. They don't like change, and their eating and their sleeping patterns are very irregular. But that doesn't necessarily mean that they'll be this way all of their life. We know that attachment and bonding is very important between their caregivers. And Harry Harlow and Margaret Harlow and Harlow and Zimmerman, they showed that attachment could not occur without contact. Contact comfort derived from a physical closeness with a caregiver. They raised a baby rhesus monkeys and they studied their behavior. So each monkey had two substitute or surrogate mothers. And one mother had her head attached to a wire frame with Marmalites and a feeding bottle. Then the other mother had the same construction, except that she had foam, rubber, and a terror cloth covering the wire frame to make it softer. And so they found that even though both mothers provided mild and warmth, the The baby monkeys preferred the cloth mother, and they clung to the cloth mother even between the feedings and went to it for comfort when they felt afraid. So it shows that contact comfort is more important and need for closeness and affection much more deeper. We know that daycare is important, but we have to be careful about daycare. Research has shown that daycare can have positive effects on social development. That, but however, when choosing a daycare, parents should carefully examine the daycare using specific guidelines. And in your text, it outlines in one of the text box things that you should be aware of when choosing a daycare. There are various attachment styles. Ainsworth came up with several attachment styles, and she said that she conducted what was called a strange situation study with babies, and she placed them in 7 stages. The parent, the child enter, explore. The stranger enter, they talk to the parent leaves. Parent returns, stranger leaves, parent leaves, stranger returns, and then the parent returns and the stranger leaves. And then she described what she saw as a result of this investigation. And there are what she called with the securely attachment, about 66%. They explored unfamiliar room. They were subdued when the mother left, and when the mother returned, they were positive and were happy to see the mom. The mom was sensitive. The avoidant insecure attachment, which is type A, they did not orient to their mother while investigating the room. They had little interest when the mom returned, and the mom sometimes ignored the child, and this was the mom's behavior toward the child. And then in the resistant insecure type C, which is about 12% of babies that she observed, they were intensely distressed when Eve, especially when the mother was absent. And then when the mom returned, they rejected the mom. They wouldn't go to the mom. And then the mom was very ambivalent towards the child. And of course, with the insecure avoidant, they had a don't care attitude. With the insecure resistant, I hate you, but I love you. So we know that the mom's behavior is totally related to her bonding with the child. Now, we talk about stages of development. We mentioned Piaget, and his theory of development was cognitive development, and he believed that children develop and had different patterns of thinking in each stage. And he describes the sensorimotor stage as 0 to 2 years. And this is where they develop the coordination, motor development, and language. In the pre-operational stage, 2 to 7 years, this is where they have that symbolic thinking, use of proper syntax and grammar. They can express themselves, very imaginative. And this is where they develop conservation. In the concrete operational, 7 to 11 years, concepts attached to concrete situations. Now they have to have something that they can see and touch. Time, space, and quantity are understood, and they can be applied but not as independent concepts. They don't have that abstract thinking ability. And then informal operations, 11 years on up, they can think theoretical, hypothetical, they can use abstract thinking and reasoning, and they can plan strategically. And the concepts learned is in one context, they can apply it to new situations. That was Piaget. Assimilation and accommodation. Piaget says that as children learn, they modify their schemas. And the schema is a mental model that represents the world. Piaget believed that children's thought processes change as they mature. And of course, he said they can modify their schema through assimilation, which is broadening of an existing schema to include new information. An example, a young boy knows that his pet parrot is a bird. But when he sees a rabbit outside and calls it a bird, he exhibits assimilation. His bird schema might be that all things that fly. And accommodation, modification of a schema as new information is learned. Example, if a bat flaps at him one night and he shrieks bird, if he learns it was a bat that startled him, he'll have to modify his bird schema to things that fly and have feathers. And in modifying his definition, he enacts a combination. He learns to assimilate and accommodate this new information. A child's realization that objects continue to exist even when they are hidden from view is what Piaget called object permanence. And if the the baby is in front of the furry animal and then something is placed in front of it, he thinks that the object no longer exists. It's sort of like it's out of sight, out of mind, that is hidden from view. He hasn't yet learned that the object still exists. But children usually grow out of that. In his cognitive development, also, according to Piaget, children aren't capable of conservation during this stage. And conservation is the ability to recognize that measurable physical features of objects, such as length, area, and volume, can be the same even when objects are different. For example, here he has what is called conservation of number. Pre-operational children would say that the two rows contain the number of pennies. Pre-operational children say that the second row has more pennies. Also, they are spread out, but in essence, it is the same number. Conservation volume. Pre-operational children say that the two same size containers have the same amount of water. Pre-operational children say that the taller, thinner container has more water, when in essence it has the same amount of water, although the shape is different. Conservation of mass. Pre-operational children say that the two same size balls of clay have the same amount of clay. Pre-operational children say that a squash ball of clay contains a different amount of clay than the same size round ball of clay, when it is the same size, whether it is squashed or whether it is not squashed. And conservation is a concept that's very difficult for younger children to understand. Now, centration, classification, irreversibility. Well, the centration refers to the tendency of the child to only focus on one aspect of a thing or event and exclude other aspects. Irreversibility. Children at this stage have the inability to reverse their thinking. And of course, reversibility promotes logical thinking. I can reverse what I just did. And classification abilities improve as subclasses are understood to be included in the whole class. Here, the centration, Piaget conducted what we call a three-mountain test. And he sees the big mountain, and Dave the doll sees the similar mountain. He thinks that the dummy or the rag doll is human. And Timmy's egocentrism prevents him from seeing Dave's perspective. Timmy would draw the big mountain. Centration here. Preschoolers are unable to consider all available information about the stimulus. Instead, they focus on the superficial, obvious elements within their sight. And these external elements come to dominance preschool thinking, leading to inaccuracy in thought. Now, we switch and talk about Erikson. Piaget focused on cognitive development. Erikson focused on the psychosocial development. And here he also has different stages. The emphasis stage, he says, age 1 year, trust versus mistrust. And he says that if needs are met, the infants develop a sense of basic trust. And then the toddler, which is the 2nd year, which is termed autonomy versus shaming down. Toddlers learn to exercise will and do things for themselves, or they doubt their abilities. They like to be independent. And by the time they get the preschool years, 3 to 5 years, this is initiative versus guilt. Here he says preschoolers learn to initiate tasks, carry out plans, or they feel guilty about efforts to be independent. And elementary school years, 6 years to puberty, competence versus inferiority. Children learn the pleasure of applying themselves to tasks where they feel inferior. And then, of course, in the adolescent years, 13 to early 20s, depending on which text you use, this identity versus role confusion. They're still trying to find themselves, find who they are, dealing with crises. And of course, if they cannot deal with that crisis, they become confused or they withdraw. And of course, early adult, 20 to 30, some texts earlier, intimacy versus isolation. This is when they start having forming relationships, love relationships, intimacy. And they'll be isolated, or other people may suffer from loneliness if they are unable to complete this stage of development. And of course, middle adulthood, 40 to 50s, generativity versus stagnation, creativity, productive in life. And by this time, if they are unsuccessful in dealing with this crisis, they'll be passive, self-centered, and feel that they've not accomplished anything in life. And later adulthood, ego, integrity versus despair. They usually enjoy life and they don't fear death. They've just about accomplished what they're going to do in life. And of course, if they are not successful here, they feel like their life is empty and will fear death. Gender role development, sex, gender and gender stereotypes. And sex refers to a biological distinction between males and females. Example, the time in the puberty, girls' sexual organs mature before boys. They usually go into puberty before boys. And gender refers to a learned distinction between masculinity and femininity. Example, girls and boys' attitudes toward dogs. Early on, American society teaches that boys that playing with dogs is considered a girlish thing to do. Gender stereotypes. These are societal beliefs about characteristics of males and females and what society thinks roles of the female should be and roles of the male should be. When we talk about Vygotsky, he was one of the social cultural psychologists that developed a zone of proximal development. His social cultural theory, zone of proximal development, is his term for a range of tasks that a child is in the process of learning to complete, and the lower limit of zone of proximal development is the level of skill reached by the child working independently, also referred to as the child's actual developmental level. The upper limit is the level of potential skill that the child is able to reach with the assistance of a more capable instructor. Of course, his principles of his theory states that it is considered to be the difference between what a child is able to do with guidance and what they are able to do without guidance. Here's an example. Children learn specific models for communication, explanation, expression by playing or interacting with others while at home or at school. In other words, the more after he has received instruction repeatedly from an adult, then he will learn to become independent and does not need that guidance anymore. And then we come to Kohlberg's theory of moral development. Kohlberg focused on moral reasoning, or why people think the way they do about right and wrong. He proposed that people pass through three levels of moral development, and he divided each level into two different stages. Here, level one, pre-conventional morality. And in stage one, he said that obedience and punishment, the behavior is driven by avoiding punishment. Will I be punished for what I do? And then stage two is based on strictly the individual interest, behavior driven by self-interest and rewards. What's good? What's in it for me? Will I be rewarded? Level two, conventional morality. And then stage three of this theory, it is more interpersonal, and the behavior is driven by social approval. And in stage four, by authority. Behavior is driven by obeying authority and conforming to social order, rules. And then level three, post-conventional morality. And stage five of this theory, social contract. The behavior driven by balance of social order and individual rights. And in stage six, universal ethics. What is morally ethical about what I do or don't do? And the behavior is driven by internal moral principles. So he said that people think in different ways on how they reason about right and what's wrong. Now, Dr. Kubler-Ross' stage theory of death and dying, she began working with terminally ill patients, and as she worked with these patients, she began to work with them and observe their emotions as they were going through the grief process of dying. And of course, during this time, terminally ill patients were not always told they were dying, and death was not a topic of discussion. And so her research became very controversial. And she began to study patients' reactions to their terminal illness and found that most people experience certain emotional states. And so the grief states that she described was, she said they first deny, they go through denial. This can't be happening to me. And their response, surely I'm not that old. They're retired. Then they go through a stage of anger. Why is this happening to me? What stupid policy is retirement at 60? They go through bargaining. I promise I'll be a better person if maybe I can get an extension. Depression, I don't care anymore. Or why should I do a good job anymore? Acceptance, I'm ready for whatever comes. This is the terminally ill patient. This is the dependent retiree response. I can enjoy a new life in retirement. And she definitely said that these dying trajectories depends upon individual personality, the effects of age or illness, and what sort of care is received. And of course, there are others who develop grief stages of death and dying, but Kubler-Ross stage said that her stage could fit any situation, but she was highly criticized. So this is a brief introduction to human development. And once you finish this presentation, complete your 10-question multiple choice quiz.